Can forensic swabs confirm or disprove sexual assault? Imagine a tiny swab that can tell a story about what happened during a sexual encounter. Forensic swabs are used in sexual assault investigations to collect biological evidence like semen, saliva, or skin cells. These sterile tools are carefully used by trained professionals to gather samples from the victim's body, clothing, or environment. The goal is to find foreign DNA that might link a suspect to the scene or the victim. When forensic swabs are analyzed in a lab, they can reveal if someone's DNA is present on or inside the victim. For example, vaginal, anal, or oral swabs can detect semen or saliva from a suspect. This evidence can be very powerful in court, especially if a suspect denies any contact. However, it's important to understand what this evidence can and cannot do. Finding someone's DNA on a victim confirms that contact occurred, but it does not prove that the contact was non-consensual. Many sexual encounters are consensual, and DNA evidence alone cannot determine if assault happened. The presence of DNA shows that contact took place, but it does not address the issue of consent, which is central to sexual assault cases. There are also limitations to forensic swabs. Sometimes, even if an assault happened, no foreign DNA is found. Factors like condom use, delay in reporting, showering, or the nature of the assault can affect DNA detection. If a person washes or cleans themselves after an assault, evidence might be lost. Also, collecting DNA does not prove whether the act was consensual or not. Proper collection is crucial. Evidence collected by professionals with documented procedures is more reliable. Self-collected samples or at-home kits are generally not considered admissible in court because they risk contamination and lack a clear chain of custody. Additionally, not all sexual assault kits are tested for DNA due to resource limitations or investigative choices. It's also important to remember that forensic evidence is only one part of a complete investigation. Medical professionals examine injuries, collect clothing, and document physical findings. The absence of visible injuries does not mean an assault did not happen. Conversely, injuries can support a victim's account but are not definitive proof of assault. From a sexual health perspective, forensic swabs can also be used to test for sexually transmitted infections. These tests are separate from DNA analysis and are vital for the health of the survivor. Detecting an infection can lead to timely treatment and prevent complications, but STI results do not confirm or disprove assault. If someone experiences sexual assault, seeking medical care promptly is essential. A healthcare provider can collect evidence, assess injuries, and provide STI testing and prevention measures like emergency contraception or prophylaxis for infections. Reporting to law enforcement is a separate process, and survivors can choose to seek medical help without immediately making a report. In summary, forensic swabs are a helpful tool in sexual assault investigations. They can confirm that contact occurred but cannot prove or disprove that an assault was non-consensual. Consent is a complex issue that DNA evidence alone cannot resolve. Comprehensive support involves medical, forensic, and emotional care, all provided by trained professionals. Always encourage survivors to seek professional help and personalized advice from healthcare providers, as each situation is unique.